Maria.
Hi.
Hi. Make yourself comfortable.
Thanks.
Yeah. How was your drive here?
Good. There's some traffic in the parking lot, but other than that, not that bad.
Not a lot of construction?
Well, there was a little bit, but it wasn't too bad.
Oh, that's good.
Yeah.
Well, to summarize, last session we had,
Yeah.
we kind of discussed how this presentation is still really causing a lot of stress and anxiety.
Yeah.
And you talked about that you're having some difficulty with your children. You said you've been feeling guilty with losing your temper with them at times.
Yeah. Yeah. It used to be like that. Yeah.
And the presentation is about a week and a half away now.
Yeah.
So is that right?
Oh gosh, it's getting closer. Oh my goodness. Just even thinking about it makes me really nervous. Like my hands are getting like, I don't know if you can see that.
Yeah.
They're like really sweaty and they're shaking.
Yeah,
But yeah.
my nose are shaking.
Oh, yeah. Even talking about it just makes me feel really, really nervous. Yeah.
So I feel that you're still really feeling a lot of anxiety surrounding the presentation, perhaps even more so now that it's closer.
Definitely. Yeah. I get my nails a lot. I just like do a lot of things that I feel like I didn't even do as much before, or maybe I'm just more aware of it now. I don't really know, but it's just awful. Like, so it's just silly. Like my hands are red and like they get all sweaty, and then like I don't know what to do with my hands, and they're just like moving all over the place just thinking about it, and my heart starts to beat really fast, and just like all these physical sensations, and this is just like thinking about it and not even like actually being there yet, you know. Yeah, I mean, there's still some time to go with it. But here I am having all these symptoms still, so I don't know.
So I hear you saying that the stress is just seeming to increase more. Now you're experiencing sweaty palms and your hands are red. You're picking at your fingernails more.
I know.
Is that right?
Yeah, I mean, I actually just picked off all my nail polish today because that's how nervous I was.
Okay.
Like at work, you know, we had a meeting today and we were talking about, you know, this big presentation and all sorts of other things as well. It was a really long meeting actually. So here I was sitting picking away at my nails, and now look, like completely cleaned off. Like that's pretty bad. I don't think I really even used to do that before. But yeah.
So how are things going at work?
I mean, I'm still really nervous about this presentation. It's always there in my mind, like even if I'm at work or like at home or commuting or with my kids or, you know, at any time during the day when I'm like awake, I have it on my mind, you know. And well, now like I think my fears even increased to like, what if I do so bad that I get fired, or like, oh my gosh, I might lose my job. But like, I mean, really, realistically, I don't know if that's really gonna happen. But I mean, who knows? It could, you know. And like, those are just the thoughts that like go through my mind a lot. And I just feel so nervous about it. Yeah.
So it sounds like you're still having a lot of those repetitive thoughts of perhaps maybe not looking competent in front of your colleagues and
Right.
not being able to focus at
Yeah.
work.
Yeah. Well, like when I'm at work, I mean, I do what I need to do to get things done. It's just when this presentation talk comes up and all of that, then I get nervous. Like I am right now just talking about it, you know. And like, I mean, at work, I guess maybe I'm more so aware of that nervousness than during other times of the day because I know it's related to work and, you know, it's the whole atmosphere there and all of that, so I don't know.
You had mentioned previously in our past sessions that you were concerned about, while you're out there presenting, that your fellow colleagues or employees,
Yeah.
they might ask you a question and you'd feel rather incompetent and not know how to
Yeah,
answer
like what if I
it.
don't know the answer, you know? Oh my gosh, I'm gonna like stand up there and look really stupid. Like if they ask some sort of question and like I'm supposed to be the expert on this, I'm the one presenting. And I think I had said it before, but you know, it's not like in high school when I had to do presentations, and I'm still nervous then, but it's not the same because, you know, your teacher knows you're not the expert on whatever you're presenting, and so does like the rest of your class. But this is your job, and you're supposed to be more or less the expert on what you're presenting. So what if they ask me something and I don't know? Like, that just makes me look bad. So those are kind of the things that I think about a lot.
I wonder if your supervisors perhaps picked you because they thought you were the most qualified and competent to make the presentation.
No, you know, I hadn't really thought of it like that. I don't know. Maybe. I mean, I'm not the newest, but at the same time, I'm not like the one who's been there the longest either. Who knows? It's a good thought, I guess. Yeah.
So, kind of surrounding the nervousness and anxiety, how are things going outside of work with your family?
Well, oh gosh, I'm getting a lot of pressure from my husband about, you know, just calm down, like things will be okay, you're not gonna lose your job kind of thing. But he doesn't get it, you know, I mean, he's not working at the same place, he doesn't know, and he doesn't know what it feels like to be me and like in my skin and like have the sweaty palms and the heart beating fast and like the hands shaking and all of those symptoms. Like, I don't know. Yeah, it's actually gotten worse now to the point where I have kind of avoided being at home more so and picked up, well, a really bad habit of drinking now. It kind of temporarily like relieves like having those thoughts, or like it gives me something else to focus on. Yeah. So I feel really guilty about that too, because it means I'm not at home, spending time with the kids and all that. So I don't know. Yeah.
So, how often and how many drinks do you consume on these times?
Well, I'd say about 4 or 5 drinks when I go out, so that's about 3, 4 nights out of the week. And that's like not including weekends, so pretty much, you know, the whole work week. So I guess one of his things is now like having to, you know, handle the kids by himself. And I feel bad, but like, what am I supposed to do? You know, like, there's only so much I can take between work and home life, and it's just hard.
Does your husband know where you were going when you go out to drink, or does he know?
But he does now. He does now. At first I just kind of tried to hide it and be like, yeah, I'm working on my project, blah, blah, blah. And then, you know, he'd confront me at home and be like, well, you shouldn't be so nervous. You're always working on your project. So then it finally had to come out and, like, you know, I finally had to say, well, actually, I haven't been working on my project. And I don't know. And then he just started yelling at me about that. And how, like, you know, if I really wanted, you know, to not seem stupid in front of my colleagues, or like, you know, to kind of calm my nerves, then I would have been working on it so that I could be like more comfortable with it and the material and things like that. That's, you know, what he tells me. But yeah, so we get into arguments about that back and forth, and I feel like this is taking a toll on the whole life.
So it sounds like you've developed a different way to cope with your feelings of anxiety and stress from
Yeah.
the presentation.
Yeah. And I never thought of myself as being one of those people who had turned to alcohol and, you know, in times like this, I guess. I've never had a problem with it before, you know, but I feel like it's causing problems with my marriage now, and yeah, I don't know that it's really helping anything besides temporary relief from my like anxiety and like those thoughts about, oh my gosh, I'm gonna seem stupid, blah blah blah, what if this, that, and the other, so.
So, has anything else aside from drinking helped you at all? Have you tried anything? Any alternatives?
No, I mean, earlier it used to be like just spending time with the kids at home, but I haven't really been doing that now since I've been going out and drinking, and by the time I get home they're asleep and arguing with my husband, so I mean, I spend time with them on the weekends, and I in the house and we go out and play or do something as a family. I guess that kind of helps, but yeah, we haven't really done much else.
So, you described that drinking is a temporary relief
Mm-hmm.
of the nervousness you're feeling about the presentation.
Mm-hmm.
Can you tell me more about that? How you feel as you're drinking?
Well, I feel like it's just like, you know, being in that atmosphere, it takes my mind off of like work more so than being at home and doing my like day-to-day things where I can kind of operate kind of on like pilot mode, you know, and then like those thoughts are able to come in more so when I'm at home and doing like the normal day-to-day things. Whereas if I go out and drink, I'm focused on that atmosphere, what's going on, like what I want to drink, what I want to eat, like, you know, whatever. And so I don't really think about work as much. So I guess in that sense, it just helps me to kind of forget about that temporarily. But then, you know, again, once I'm back home or once I'm sobered up a little bit, those thoughts come back.
So what I'm hearing is when you go out to drink,
Mhm.
your mind's taken off the presentation and everyday things, and you're focusing on more in the moment, what you want to drink or what you should do next or what you should drink next. Does
Yeah.
that sound right?
Yeah.
Okay.
It's easier to be more present when I'm not drinking, I guess, more or less, rather than when I'm at home.
You said the word present again. You
Mhm.
had said that in our last session too. You mentioned the word present. Can you tell me more about that?
Well, I guess over time now, in anticipation of this presentation, I've become, especially at home, like I said, I've become less present with what's actually going on right there in front of me. And I'm very much more so wrapped up in my thoughts and what I'm thinking as far as the presentation and, oh my gosh, I have to get this done and then this stuff done and then, oh my gosh, the kids, this, that, and the other. And like, it's just a whole bunch of different thoughts. A lot of times the work ones will come in and out, but more so when I'm at home than anywhere else. So it's hard to stay focused on the kids or making dinner or the chores that need to be done when I'm thinking about work and, oh my gosh, like here's my mental like to-do checklist going on in my head and like, oh, what if I forget one thing, like because it's all up here and whatever written down, and I'm thinking, well, maybe I should write it down, and like, you know, my thoughts are just going here and there and all over the place with this presentation or like things to do related to this presentation when I'm at home. So I'm not really actually focusing on, you know, whatever's going on. I guess that's what I mean by present.
about mindfulness techniques last time.
Yeah.
And you had expressed interest in that when we were talking about being in the moment and being present.
Right.
Is that something that you're still thinking
Definitely.
about?
Yeah, that would be nice to know some of those things. Maybe that would be helpful I guess at home, more so than anywhere else, just because mind wanders a lot.
So what mindfulness is, just really briefly, mindfulness exercises, they let you take in the moment and sense and feel what you're experiencing at that moment.
So it'll help me to be more present?
That's what it's supposed to do. It has been shown in research to actually reduce stress, decrease negative thinking.
Oh, that would be nice.
Reduce
I don't know what
stress.
that feels like right now. Yeah.
And each individual is different, but the breathing exercises that we had discussed previously, that's a type of mindfulness exercise that
okay.
that we could definitely try next time.
Yeah.
And see how that goes.
I guess I hadn't really thought of that fitting in with mindfulness, but hey, what do I know? Yeah.
Would you be interested in trying that next time to see
Sure.
if that will maybe help you?
Hopefully, yeah, that'll be before my presentation, right?
Yes, definitely.
Okay, yeah. Oh, yeah, then I'd be able to use it, hopefully, if I think about it. Yeah. Great.
So, tell me, you had said that you haven't seen your children as much during the week.
Yeah, I feel so guilty about that. I think I told you last week too, that I feel really guilty for not really being there for them or with them, but maybe they're picking up on a lot of my anxious habits, the picking, the nails, all that kind of stuff, and maybe them being a little bit more sensitive to when I'm yelling at them or more harsh or whatever it may be, because I'm not really focused on them at home. So yeah, that's something I haven't really talked to anybody about, even my husband, because here we are arguing about work and this, that, and the other. And I mean, I don't know that he can tell that I feel guilty about that, but I do. I think any mother would, or any good mom would, I guess. So it's kind of hard to feel that way.
Sounds like you're still feeling a lot of guilt around your children, that they may be picking up on your nervous habits.
Yeah.
Is that right?
Mm-hmm. I don't want that for them, me feeling it and experiencing it myself, why would I want them to go through that ever, So, I don't know, it would be nice if I could kind of keep myself under check or under control or whatever you want to call it, so that they're not seeing as much of it maybe. And then that way, my hope is, I guess, that then they won't be as exposed to it and they won't be picking up on those behaviors and doing it themselves and all that. So I don't want them to end up like that, like me in that sense,
Mm-hmm.
Yeah.
And this started the nervous habits and the guilt around your children. That all started with the presentation.
Yeah. Yeah, I mean, there wasn't anything else really before that to kind of trigger this much anxiety. I mean, I haven't had a big presentation at work like this before, ever, even though I've worked there for, 3 years. It's always been someone else who's had to do it, which has been really, really nice for me, of course, because that way you can just avoid it and slide right through. It's great, but I guess now it's my turn. And go figure, there's all these problems coming up surrounding that. And in a way, it's a little bit frustrating too to think that just this one thing, or one area at work is stressing me out so much that it's causing all these other problems in so many other areas of my life, you know.
Have you done any more work on the presentation since it is getting close?
Yeah,
Okay.
we're pretty much done with it. I gotta do a few more things and stuff, but most of it is done.
I wonder if it would help if you started out small before the big presentation, perhaps presenting it in front of your family or
Oh
a
my
few
God.
close friends. How does that sound? Still pretty
That's even just like
anxiety-provoking?
nerve-wracking. Maybe it's even more so because, oh my gosh, they know me.
Okay.
So like now really like, oh God, I might look really dumb.
Okay.
Like they know who I am like on a day-to-day basis, and that's very different from, I think, or at least I think, from a professional sense of who I am. So I don't know how well that would go over, but.
So it sounds like just presenting in front of
Anybody.
Anybody.
Yeah, I think so. Just in front of anybody would be hard.
Well, to summarize, we talked about today how you're still feeling a lot of nervousness and stress
Mhm.
with this big presentation.
Yeah.
It's still affecting your family, and you're feeling a little guilty about your children picking up on your nervous habits,
Yeah.
your nails.
Oh gosh, yeah.
And you've also started to, in the past week, you started drinking, adapting an alternative coping mechanism.
Yeah. Oh gosh, not a good one. Yeah.
And then we also talked about how your presentation is coming up, and you're almost done with it, but you're still feeling a lot of anxiety, even doing
just
practice
like actually
presentations.
doing, it, or even to give a practice one, heartbeat, yep. Leg shaking even. It's bad. Definitely have to agree with all of that. So yeah, it would be nice maybe next time to go over some more mindfulness stuff, or
Definitely.
things that I can use.
Mhm.
I mean, I don't want like the drinking to go any further or anything like that.
So that's a great goal to have for next session. We can focus on those breathing exercises and talk about how you're feeling once the presentation is going to be even closer then.
Right.
Are there any questions in general you have for me today about our session or anything?
No, not that I can think of. Yeah.
So how do you think session went today?
Well, it was really hard for me to talk about the family piece, about feeling guilty and not really having told anybody else that. Because I don't know that that comes through or that shows through necessarily to other people, you know. So that was a hard place to go.
Thank you for sharing.
Thanks.
Did you want to schedule another appointment for another session?
Yeah, definitely, yeah, before, oh my gosh, before my presentation.
Of course.
Yes. And hopefully get in for that.
Well, thank you, Maria, for coming in
Yeah,
today.
thanks.
Thank you so much. You take care until next time.
Okay.